Please take your seats. Presidents, Vice President, members of Council, Deans, Registrars, distinguished guests, you're all very welcome to the Royal College of Surgeons in Ireland and to the conferring ceremonies this evening. Before declaring open the conferring ceremonies, may I first introduce the platform party. At the seat to the front, from your right, is Professor John Crowe, President of the Royal College of Physicians of Ireland. Beside him, Mr. Declan McGee, President of the Royal College of Surgeons in Ireland. And at the stage to the back, from your right, is Professor Oscar Traynor, Dean of Postgraduate Surgical Training and Education. Professor John Hyland, Vice President of the Royal College of Surgeons in Ireland. Professor Hannah McGee, Dean of the Faculty of Medicine and Health Sciences, RCSI. Ms. Adele Hester, Sarah Representative, RCSI. Mr. Martin Cunningham, Sarah Representative, RCSI. Dr. Pádraig Sheeran, Dean of the Faculty of Sports and Exercise Medicine at RCSI. Dr. John S. Walsh, Dean of the Faculty of Dentistry at RCSI. Dr. Barry Kelly, Dean of the Faculty of Radiologists, RCSI. Dr. Martin Daly, Treasurer of the Faculty of Sports and Exercise Medicine of RCPI and RCSI. Professor David Ryan, Honorary Secretary of the Faculty of Dentistry at RCSI. Dr. Max Ryan, Honorary Treasurer of the Faculty of Radiologists of RCSI. Professor Sean Tierney, Dean of Professional Development and Practice at RCSI. And my name is Cathal Kelly, CEO Registrar of RCSI. I now invite the Dean of Professional Development of Practice at RCSI, Professor Sean Tierney, to introduce the candidates for the Fellowship of the Royal College of Surgeons in Ireland.
So I invite the candidates for the Fellowship of the Royal College of Surgeons in Ireland to rise and recite the declaration in unison with me, which is on page 5 of your booklet. I, and state your name, do hereby solemnly and sincerely declare and promise that I will observe and be obedient to the statutes, bylaws and ordinance of the Royal College of Surgeons in Ireland, and that I will, to the utmost of my power, endeavour to promote the reputation, honour and dignity of the said college. I now call on the President to admit you Fellows of the College.
By virtue of my office of President, I admit you Fellows of the Royal College of Surgeons in Ireland.
I now call on the candidates to come forward and receive your scroll from the President. In cardiothoracic surgery, Wen Seng Su. In general surgery, Tom Gallagher. Shahid Kaimkhani.
Shahid, congratulations, very well done.
James Murphy. Desmond Toomey.
Congratulations, well done.
In neurosurgery, Owen Fenton. In absentia, Catherine Ruby Tambiraju. In oral and maxillofacial surgery, Murthy Halsnad. In otolaryngology, Emma Cashman. Paul Lennon. David McCall, in absentia. Emer Phelan.
Congratulations, very well done.
In pediatric surgery, Farhan Tareen. In plastic surgery, Fuan Chang Chan. In trauma and orthopedic surgery, Stephen Brennan. Grania Colgan. Parnell Keeling.
Very well done. Congratulations.
Alan Malloy.
Congratulations.
Terence Murphy.
Congratulations.
And Joseph Quealy. In urology, James Ford. William Shields. In absentia, Elizabeth Smith.
Congratulations.
And then Fellows Ad Eundem, Mohammed Yasser Arafat.
Very well done.
Chandresa Karan Kalia Perimal.
Congratulations. Very well done. Very good.
Pavel Prezenicia.
Congratulations, and you're very welcome.
Now, I'd like to invite the candidates for the membership of the Royal College of Surgeons to rise and recite the declaration in unison with me, and this declaration is on page 5 again of your booklet. I, and state your name, do hereby solemnly and sincerely declare and promise that I will observe and be obedient to the statutes, bylaws and ordinances of the Royal College of Surgeons in Ireland, and that I will, to the utmost of my power, endeavour to promote the reputation, honour and dignity of the said college. I now call on the President to admit you members of the college.
By virtue of my office of President, I admit you members of the Royal College of Surgeons in Ireland.
Now I call on each of you in turn to come forward and receive your scroll from the President. Mohammed Abd El Magid. Rami Abdulatif. In absentia, Amar El Lawati. In absentia, Abdul Rahman Al-Afai. Suzanne Beecher. Jarlath Bulger. Hansin Bu. Connor Bowe. David Oren Brinkman. Mark Bro. Christina Buckley. Thomas Burke. Olin Carmody. John Cassidy. Kira Clark. Anthony Cullen. Naomi Fearon, Ian Feely, Conal Fitzgerald, Hannah Fleming, Michael Flood, John Gibbons, Ali Gull, Saeed Hassan, Paul Healy, Daniel Hector, Robert Kenyon, Rebecca Lyons, Paula McQuail, Brenda Murphy, Matthew Nagel, in absentia, Clina Nifolu,
We can still do it this way. Thank you.
Aileen O'Shea, Bilal Rafiq,
Congratulations, well done.
Sarah Ryan,
Sarah, congratulations, well done.
Shiva Sharma, Gerard Sheridan, Laura Sweeney, Jeffrey Chi Lung Tan, Gerard Thong, Haroon Rashid, the membership in ENT, Ali Kassim, Tava Kumar Subramaniam,
Well done.
the membership in ophthalmology, Emma Dignan. Doa Saeed Esaid. Reinhold Goetz. Khalid Kamel. Darren McAteer. And Patricia Smolarek Kazprazak.
I now invite the Dean of the Faculty of Radiologists, RCSI, Dr. Barry Kelly, and the Honorary Treasurer, Dr. Max Ryan, to introduce the candidates for the Fellowship of the Faculty of Radiologists.
Evening. Will the candidates for Fellowship of the Faculty of Radiologists please rise and recite the declaration listed on page 5 in your booklet? I can't hear you. We'll start again. I do humbly and solemnly and sincerely declare and promise that I will observe and be obedient to the statutes, bylaws and ordinances of the Royal College of Surgeons in Ireland, and that I will, to the utmost of my power, endeavour to promote the reputation, honour and dignity of the said college. Thank you. I now invite the Dean, Dr. Barry Kelly, to admit the new Fellows.
By virtue of my office of Dean, in the presence of the President, I admit you Fellows of the Faculty of Radiologists of the Royal College of Surgeons in Ireland.
Now I will call each of you in turn to come forward to receive your scroll from the Dean. Radio Diagnosis, Adele Marie Kelleher. Umar Salati. In radiotherapy, Daniel Cagney. Kathy Rock.
I now invite the Dean of the Faculty of Dentistry of RCSI, Dr. John S. Walsh, and the Honorary Secretary, Professor David Ryan, to introduce the candidates for the Fellowship of the Faculty of Dentistry of RCSI.
I will now introduce the candidates for Fellowship of the Faculty of Dentistry, including Ad Eundem. Will the candidates please rise and recite the declaration listed on page 5 of your booklet in unison as follows. I, and give your name, I do hereby solemnly and sincerely declare and promise that I will observe and be obedient to the statutes, bylaws and ordinances of the Royal College of Surgeons in Ireland, and that I will, to the utmost of my power, endeavour to promote the reputation, honour and dignity of the said college. I will now invite the Dean to admit the new Fellows.
By virtue of my office of Dean, in the presence of the President, I admit you Fellows of the Faculty of Dentistry of the Royal College of Surgeons in Ireland.
Now I will call each of you in turn to come forward to receive your scroll from the Dean. Oral Surgery, Kelly Podlosky, in absentia. Oral Surgery with Oral Medicine, Adil Murtaza. Ad Eundem, Patrick Cleary. William Fenlon. Catherine Harley. And Richard Ibbotson. I will now introduce the candidates for membership of the Faculty of Dentistry. Will the candidates please rise and recite the declaration listed on page 5 of your booklet in unison as follows. I, and give your name, do hereby solemnly and sincerely declare and promise that I will observe and be obedient to the statutes, bylaws and ordinances of the Royal Colleges of Surgeons in Ireland, and that I will, to the utmost of my power, endeavour to promote the reputation, honour and dignity of the said college. I will now invite the Dean to admit the new members.
By virtue of my office of Dean, in the presence of the President, I admit you members of the Faculty of Dentistry of the Royal College of Surgeons in Ireland.
Now I will call each of you in turn to come forward to receive your scroll from the Dean. Mansour Manar Abdallah. Ala Abdul Rahim Abdul Salam. John Ahern. Fatima Aliyan, in absentia. Sana Al-Jamani. Rory Boyd. Orla Carthy. Rebecca Courtney. Susan Crean. Karen Grealish. Daria Carmenova, in absentia. Yvonne Macaulay. Charmaine Memon. Francis Xavier O'Brien. Caroline O'Dwyer. Kira O'Reilly. Elaine Shore. And Jennifer Waldron. We will now proceed with the presentation of the member of General Dental Surgery of the Royal College of Surgeons in Ireland. I will now call on Susan Butler to come forward and receive her scroll from the President, Mr. Declan McGee. It should have been, yeah. From the Dean of the Faculty. Diploma of Primary Care Dentistry. I will now introduce the candidates for Diploma of Primary Care Dentistry of the Faculty of Dentistry. I will call each of you in turn to come forward to receive your scroll from the Dean. John Ahern. Elham Borwis. Geraldine Duggan. Hasina Hassanbakas. And Francis Xavier O'Brien.
The Faculty of Sports and Exercise Medicine is a joint faculty of the Royal College of Physicians of Ireland and the Royal College of Surgeons in Ireland, and fellowships are awarded in the presence of the President of RCPI, Professor John Crowe, and the President of RCSI, Mr. Declan McGee. I now call on Dr. Pádraig Sheeran, Dean of the Faculty of Sports and Exercise Medicine, and the Treasurer, Dr. Martin Daly, to introduce the candidates for Fellowship of the Faculty of Sports and Exercise Medicine.
Will the candidate rise, please, and recite as follows from page 5. I, Patrick Adrian Mary McGoldrick, do solemnly and sincerely declare and promise that I will observe and be obedient to the statutes, bylaws and ordinances of the Royal College of Surgeons in Ireland and the Royal College of Physicians of Ireland. And that I will, to the utmost of my power, endeavour to promote the reputation, honour and dignity of said colleges. I now invite the Dean to admit the new Fellow.
By virtue of my office as Dean, in the presence of the President RCSI and the President RCPI, I admit you Fellow of the Faculty of Sports and Exercise Medicine of the Royal College of Surgeons in Ireland and the Royal College of Physicians of Ireland.
Dr. Patrick Adrian Mary McGoldrick.
It now gives me great pleasure to introduce the President of the Royal College of Surgeons in Ireland, Mr. Declan McGee, to address the Assembly.
President of the Royal College of Physicians of Ireland, Vice President, Royal College of Surgeons in Ireland, past presidents, members of council, registrar, deans, officers and board members of faculties, academic staff, ladies and gentlemen. It gives me great pleasure as President to welcome you all to the Royal College of Surgeons this evening for this very happy event and celebration. Including those conferred in absentia, we have just conferred 32 surgeons with intercollegiate fellowships and 74 with memberships, including 4 in ENT and 6 in ophthalmology. 5 radiologists have been conferred with fellowships of their faculty in radiodiagnosis and radiotherapy. 13 dentists have received fellowships, along with 116 receiving memberships and diplomas of the Faculty of Dentistry. And finally, there have been 2 fellowships of the Faculty of Sports and Exercise Medicine. So congratulations to you all on your achievements and on reaching this important and exciting stage in your career and training, and we wish you continued success for the future. We also welcome your family and friends who have supported and encouraged you in your endeavours and now come to share in celebrating your achievement. Many of your family and friends are making their first visit to the college, and we extend a special welcome to them, but I did notice quite a few faces that I've seen somewhere before. It is a common occurrence across all professions for some children to strive to follow in their parents' footsteps. The healthcare professions are no exception in this regard, and it is heartening to see that any notions of pessimism about our health services and what the future holds for professionals have not deterred you from pursuing your preferred path. For some of you, today's qualification is an important milestone and gateway on your training journey. For others, the parchment which you received indicates that you've completed a formal and comprehensive training program and a rigorous and testing assessment and are now poised and ready for practice as a specialist in your chosen discipline. Even in these troubled times when the future seems uncertain and sometimes unattractive, and when it would be easy to be despondent about your career prospects, I believe the answer is to continue to strive for clinical and academic excellence, and the rewards and professional fulfillment will follow. Irish clinicians, including doctors and dentists, have been in difficult, depressing circumstances before, but it doesn't last forever. We and RCSI, and indeed our sister colleges and training bodies, will do everything possible to ensure that the nature and quality of consultant posts to which you aspire and the healthcare environment in which you will labour will remain appropriate to your expertise and to the effort and hard work you've invested. And in the meantime, all of us must maintain our standards, our professionalism, so as to preserve the integrity of our professions. While those of you conferred today could be regarded as a somewhat disparate group with rather different areas of expertise and practice, what you share is that you are all clinicians, with the patient always at the centre of your focus. In recent times, the need for doctors to be excellent clinicians may have been questioned and devalued, particularly with the advent of greater and greater sophistication in our diagnostic aids, and in particular diagnostic imaging as practiced by our radiology colleagues. A new evangelist for bedside medicine and clinical skills is the American, Ethiopian, Indian Dr. Abraham Verghese, best known to many of you as the author of that wonderful novel, Cutting for Stone, but also professor of the theory and practice of medicine at Stanford Medical School. Dr. Verghese received an honorary doctorate at our June undergraduate conferring and gave an inspirational address to the Assembly. He has decried the demise of clinical ability, and in his campaign for more clinical teaching, he has written that the question is not whether physical examination alone is better than the chest film in diagnosing pneumonia, but whether physicians who combine both approaches deliver better outcomes to their patients than had they used one approach alone. And again, he writes, technology drives diagnosis, but it often merely substitutes our fear of uncertainty with delusions of certainty. Another quote, facetious this time, which I really like, the real patient is now in the computer, what I call the eye patient, while the patient in the bed has become an icon and simply exists to indicate that there's a file in the computer. And so we must maintain our commitment to the primacy of clinical practice in bedside medicine, a long-standing hallmark of Irish medicine and still valued in our undergraduate schools and in our postgraduate training programs. Speaking of our training programs, some of those receiving their membership today are the flag bearers of our new streamlined surgical training pathway, championed and spearheaded by my immediate predecessor, Professor Brough. Those of you from that program are certainly taking no chances with the obligation to have acquired your membership before the end of the first 2 years. Well done. This new program was born out of an appreciation that surgery was losing its appeal as a career choice for our new and best graduates. There were many reasons for this, and some of them were identified in a poll of students, new graduates, and trainees in post. Our sister college, the Royal College of Surgeons of England, recently completed a similar poll with similar results. Poorly structured and too long training, work-life balance, overly competitive and aggressive surgical culture, poor undergraduate anatomy teaching, the latter not an issue in our medical school, I would hasten to add, etc. Worryingly, or perhaps not, no respondent cited uncertainty as to whether they possess sufficient manual dexterity as a reason for not choosing surgery. I will finish with a quote from one of my surgical heroes, Dennis Burkitt, a fellow from Annaman and surely the epitome of a real clinician. He spent most of his professional life in Africa working with very limited resources and is most renowned for the discovery of the epidemiology, cause and treatment of a common heretofore fatal childhood cancer, Burkitt's lymphoma, and subsequently also for identifying the role of diet in many common diseases. Among many international awards, he received an honorary fellowship of this college in 1973, and in later years, when asked to inscribe his books, he often wrote the following, which I believe to be wise counsel for all clinicians. Attitudes are more important than abilities. Motives are more important than methods. Character is more important than cleverness, and the heart takes precedence over the head. Thank you, and congratulations once again.
Ladies and gentlemen, the formal proceedings are now concluded. We'd invite you, our guests, to join the new fellows, members and diplomates for a reception in the College Hall. Can I ask you to please stand for the outward procession?